Antibiotic can be prescribed for an animal where there is evidence of infection. For a dairy cow, this could be a clinical examination, or, as is more common for dry cow treatment decisions, using individual cow information such as milk recording results and clinical mastitis records. A question commonly asked is, what SEC cutoff do I use to identify cows that should get antibiotic dry cow treatment? It's important to know that there is no one-size-fits-all. As a guide, CellCheck suggests that cows with an SEC consistently below 100,000 cells per mil and no history of clinical mastitis throughout the lactation may be suitable for getting internal teat sealant only at drying off. If you use a higher SEC level, say 200,000 cells per mil, then you may miss some cows that had an infected quarter and may have benefited from antibiotic dry cow treatment. On the other hand, if you use a lower SEC level, say 50,000 cells per mil, you will end up giving antibiotic dry cow treatment to some cows that don't require it. For farms in the early stages of adopting a selective dry cow treatment plan and starting cautiously, they might consider using that lower SEC level of 50,000 cells per mil and increasing this over time. The SEC threshold for making treatment decisions might also be influenced by things like the prevalence of infection in the herd. In other words, the number of infected cows in your herd, and is something that should be agreed between you and your vet. We need to focus less on worrying about the perfect SEC level for treatment and focus more on making sure that cows don't get new mastitis infections at drying off, over the dry period and at calving, regardless of what kind of tube they get at drying off. Hygiene is critical at these points. If we can keep the numbers of bacteria to a minimum, then we reduce the risk of new mastitis infections next season.